So joining us now is Dr. Dyan Hes. She's the founder of Gramercy Pediatrics. So, doctor, fewer people are expected to travel for the Thanksgiving holiday. Still, the TSA says it's already screened 3 million flyers. This is over the weekend. It's the highest number that they've seen since the beginning of the pandemic. The CDC has been asking for people not to travel. Various municipalities, institutions, school districts are bracing for what they expect to be a spike in COVID cases over the next 2 weeks. And I can say from my perspective, I wasn't able to enjoy Canadian Thanksgiving with my family because of the pandemic, because I couldn't bring my family across the border. And Canada, even though they've had a very sort of strong national mandate, even though there's a high compliance when it comes to restrictions surrounding and safety measures surrounding COVID, 2 weeks after the Canadian Thanksgiving, they started breaking records for cases and hospitalizations, particularly in Ontario and Quebec. So yes, these small gatherings make a difference, but it seems like an awful lot of people are going forward with the plans that they had even before the pandemic. Do you think health officials have done enough to deter people from traveling?
No, I just think there's a lot of logistics involved. So you have to remember, the college students are really a big source of COVID in the United States. So I think responsible colleges are trying to test all the students before they go home. And, traditionally, the Wednesday night before Thanksgiving, all people get together, kids who come home from college, kids who come home from all over other parts of the country, and they meet up. So they're trying, but because our country is so fractured and we don't have a national plan and it's a state, city, locality plan, people are really going to do different things in different places. Like you heard in South Dakota, most of the state doesn't have to wear a mask, only in Brookings. So I think in New York, where we've done it right, we're not going to see huge jumps in cases. I mean, I ask my patients every day when they come in this week, are you planning on doing anything for Thanksgiving? And if they're planning on traveling, I try to talk them out of it. Honestly, most of them said no, because we have seen the worst in New York. I feel like places which are just getting hit, which don't know what it's like, people are naive.
It's so interesting, Doctor and Anne-Marie. And I don't, so the question becomes, what is South Korea doing right? What is Taiwan doing right that we in the West can't do? Because as Anne-Marie points out, even Canada, which did, Anne-Marie, was that a national plan that they put into place, or was it left up to the provinces the way it is in the United States, in the sense that we leave it, the federal government has left it up to governors to decide how to implement safety measures? Because it just strikes me, Taiwan is having full-on rock concerts now with, thousands of people, and they're not getting sick. And here we are in this country, what some would say is the most powerful country on earth, and we're unable to stem the surge.
I think a lot of it has to do with borders, right? I don't know if you wanted me to comment.
No, both of you. But I mean, Doctor, I guess, I'm curious what your
Doctor,
medical.
you're the expert.
Yeah, you're the expert.
I think in the Far East, wearing a mask is much more acceptable. They wear masks regularly in the Far East, in South Korea and Taiwan and China. It's much more culturally acceptable. There's a lot of pollution there, so people have been wearing masks for years. They're also used to listening to their government. It's a very different mindset. So like places like Singapore, it's a much more stricter regime. China, South Korea is of course a democracy, but it's a much smaller, homogeneous population than we are dealing with in the United States. We have, people are very diverse, and we have politicized this, and I'm against the mask or I'm for the mask. And until you see COVID or get COVID, you might stay against the mask because you think it's not going to happen to you. It's just that sad, actually.
I think that's a great point. I think that in Canada, there was a clear national message. You didn't have what you obviously saw here with the Trump administration. And so there was a clear national message. But, once the pandemic seemed to be under control in Canada, they started sort of this gradual opening where they had bubbles, right? You could start with your sort of primary bubble, and then they had kind of a double bubble where there are additional people. And I think, we're at that point, still learning a lot about the virus and the way that it spreads. And then here comes Thanksgiving, something that people have been waiting for half a year to sort of get a chance to see their people. And I think there was probably some loosening, some people saying, well, I'll include you in my secondary bubble so that we can all be together. And obviously, you know, also doctor pointed out, much smaller population in Canada as well. So I think that probably helped. But I think that what we saw after Thanksgiving, and that has resulted in some, you know, a return to major restrictions and lockdowns in some of Canada's biggest cities, is telling us a little bit about just how contagious this virus is and how we really need to be relentless about keeping it contained until we can find another way to manage it. But I'm going to pivot away from that, Doctor. The American Academy of Pediatrics announced yesterday a 28% increase in COVID-19 cases among children in just the last weeks. So I'm wondering your take on this, because we've talked before about kids in school and what you're seeing in your practice, and what you have seen in your practice is that, you know, the kids are not really getting infected from going to classes. So why do you think we're seeing this spike?
Well, I think it's two reasons. So I think one is that there's just massive amounts of testing now. So we're testing, you know, the Abbott test has been rolled out, the rapid test into schools. So they're testing either 20% of the school population at a time, or, you know, their kids are getting tested weekly. So we're just doing much more testing. And there are still those states where kids are going to school and there are no mask mandates. So the numbers are going to go up. But in New York, where we wear masks and we go to school, the numbers are so low. It ranges between 0.019% to 0.22% in New York City when schools were open, because the masks work. So if we just were able to keep the masks on, then we could have our kids go to school. But instead, it's like this collective punishment now because people are not following the rules. But I still am not seeing, I mean, in New York, we are not seeing an increased number of cases in children, and especially in children that are very sick.
Yeah, I mean, and it's an important point, Doctor. You know, I talk to people who say, no, I'm locked down. I don't really go anywhere, except I go to the gym and, you know, I see my friends, but we're all in the same bubble. It's just 2 or 3 friends. But people don't seem to we've talked about this, and that's essentially why we are where we are right now, because people have been unwilling, unable to sometimes buckle down. And there's a great op-ed in the Los Angeles Times written by a doctor, and I'll just quote her. She says, we're 8 months into COVID. World War II lasted 6 years and a day. The Great Depression lasted 10 years. The 1918 flu lasted 2 years and 2 months. Are we really that soft, that careless, that selfish? So that's where we are. Dr. Dyan Hes, as always, we appreciate it. Thank you very much.
Thank you. Bye-bye.